Hello, today we are going to dissect the posterior aspect of the upper limb and we are going to demonstrate the structures that are underlying it. So, this is the back and this is the scapular region. Now, this is the dissection of the back of the arm, the back of the forearm, and the dorsum of the palm. Now, starting with the scapular region, when we dissect the overlying fat and fascia, we come across the scapular region spaces. This is the scapular region space. This whole part is the scapular region space. Okay, now the point that has been shown here is the lower border point of the scapula, and this is the lateral border of the scapula. The muscle that is originating from here is the teres minor muscle. This muscle is the teres minor. The muscle that is below it is the teres major, this is the teres minor, and this scapular region spaces is divided by this long head of triceps into the triangular and the quadrangular space. So this is the triangular space. This one. This is the triangular space. It is bounded below by the teres major muscle, bounded by teres minor muscle above.
The long head of the triceps forms the base and the apex is formed at the lateral border of scapula where the teres minor and the teres major muscles converge. This space has one structure passing through it, that is the circumflex scapular vessels. It is arising in the axilla, then it winds around the lateral border of scapula to come to the back. Now if you want to see the quadrangular space, that is over here, first let us trace the teres major muscle which passes beneath the long head of the triceps. So over here you can see that this muscle tendon belongs to teres major. So now what are the boundaries of the quadrangular space? You can see medially the long head of triceps, laterally the surgical neck of the humerus, which over here is under the cover of deltoid laterally, above the teres minor and below the teres major muscle. So this quadrangular space again transmits two important structures, the axillary nerve and the posterior circumflex humeral vessels. So when you see the axillary nerve here, you will not see one nerve trunk. Why? Because while passing through the quadrangular space, the axillary nerve divides into two divisions. This division, which is more superficial while looking from the back, that is the posterior division. You can see clearly over here that the posterior division of axillary nerve supplies the teres minor muscle as well as the deltoid. Other than that, the posterior division also supplies the skin over the lateral part of the arm in the upper part, that is above the insertion of deltoid. That is the upper lateral cutaneous nerve of arm. Now if I go a bit deeper, you can see the other division of axillary nerve, that is the anterior division. The anterior division, it only supplies the deltoid. When we are looking from the posterior aspect, like here, the posterior division of axillary nerve will appear superficial and the anterior division will appear deep. Along with it, you can see there is this vessel that is also accompanying the axillary nerve. This is the posterior circumflex humeral vessel. So these are the major structures passing through the quadrangular space. Now if we come to the third space, that is the lower triangular space. As I said before, this is the long head of triceps. This is the lateral head of triceps. And for the base, you can see again that teres major is forming the base of this lower triangular space. And the nerve that is peeking out over here, this is the radial nerve along with the profunda brachii vessels. In order to show this part properly, the lateral head of triceps has been cut. Now if I reflect the lateral head of triceps like this, you can see the radial nerve and the profunda brachii vessels entering the spiral groove on the posterior surface of humerus. The radial nerve in the spiral groove gives 5 branches, 3 muscular and 2 cutaneous. So among the muscular branches, 2 are visible over here. One is the branch to the lateral head of triceps. When I remove the triceps lateral head, you can see this branch clearly. And one, of course, should go to the medial head of triceps. So if I see over here, this branch, this supplies the medial head of triceps, this one. The nerve to anconeus is not visible here because it passes through the medial head of triceps up to the anconeus. Then you can see this one, this is actually in this cadaver, it has come up as a common trunk. It contains the fibers of lower lateral cutaneous nerve of arm and posterior cutaneous nerve of forearm. How do I know that? Because if you trace this and come to this side, you can see that some nerve fibers, they have supplied the cutaneous tissue, subcutaneous tissue of the arm in the lower part, and if you look at this one, it is continuing all the way down over here to the forearm. It is ending over here by ramifying into smaller branches. So this is about the back of the arm where we get the major muscles. Triceps is the major muscle, long head, lateral head and medial head, and we get 2 neurovascular structure, the radial nerve along with its branches in the spiral groove and the profunda brachii artery. Now just for your interest, you can also see over here a nerve. This is the ulnar nerve. The ulnar nerve for its major part lies in the front of the arm. But here you can see this is the lateral intermuscular septum, medial intermuscular septum, which has been pierced by the ulnar nerve. Then briefly it appears in the posterior compartment of arm, and then it runs behind the medial epicondyle of the humerus. So this is the story of the back of arm. Now if you come to the back of forearm, you will see that I have not removed half of the fascia over the back of forearm. This is because if this is the olecranon process of the ulna, then the posterior border of the ulna is running along this line, Now 2 muscles which are important over here, the flexor carpi ulnaris and extensor carpi ulnaris, they arise from the posterior border. As the name suggests, the flexor carpi ulnaris belongs to the front of forearm. So after arising from here, the flexor carpi ulnaris goes towards this side, that is the medial side. Because it is not a part of the back of forearm, we have not removed the fascia over here. So you can see the extensor muscles, they have been exposed over here. Out of this tiny muscle, this tiny triangular muscle that you can see at the top. This is the anconeus. It is originating from the lateral epicondyle of the humerus and it inserts into the lateral surface of the olecranon process and the upper part of the posterior surface of ulna. So this is anconeus. After that, you can see the superficial muscles which originate from the lateral epicondyle of the humerus. So out of that, the first muscle that we get is the extensor carpi ulnaris. To confirm, trace extensor carpi ulnaris below. This bony prominence is the head of the ulna. The tendon of extensor carpi ulnaris, it lies in contact with the head of the ulna. Beside that, you can see this muscle and this muscle, the tiny one and the large one. If you trace the tiny muscle first, you can see that its tendon is going into the little finger over here. So this is the extensor digiti minimi, and beside that is this, the bulky muscle, comparatively bulky muscle. This is the extensor digitorum, and as you can see, the extensor digitorum, it gives off tendons which insert into the index finger, middle finger, ring finger. It should also insert into the little finger, but there is an anomaly in this cadaver because you can see that digiti minimi instead has two tendons over here. So we are, other than that, if you look at the superficial muscles, on this side you should get extensor carpi radialis brevis, then further below is extensor carpi radialis longus, and brachioradialis is not visible over here unless you look very closely. It is still covered by the fascia because brachioradialis is best visible from the front, but it is also included among the superficial muscles in the back of forearm. So here properly visible are extensor carpi radialis longus, extensor carpi radialis brevis, extensor digitorum and extensor digiti minimi, and finally extensor carpi ulnaris. Now the deeper muscles are those which are arising from the posterior surface of either radius or ulna. Because this is the radial side, lateral side, let us talk about the two muscles over here which you can see clearly that they are winding around the lateral border of the forearm. The upper one is abductor pollicis longus and the lower one is extensor pollicis brevis. Abductor pollicis longus arises from the posterior surface of both radius and ulna, whereas extensor pollicis brevis arises from the posterior surface of only radius. Then if we want to trace the other muscles arising from the posterior surface of the ulna, you get this muscle over here, and if you trace the tendon, you can see that it is changing its direction and it is going into the thumb. So this muscle over here is the extensor pollicis longus. Ideally, if the extensor retinaculum were in place, here you can only see some cut parts of extensor retinaculum, but if it were in place, then the extensor pollicis longus tendon would use the dorsal tubercle or Lister's tubercle, that is right over here, this bony prominence, as a pulley while changing its direction. So this bony prominence over here is the dorsal tubercle or the Lister's tubercle. Now we are left with one more deep muscle in this region, that is the extensor indicis. For extensor indicis, you just have to lift the tendon of extensor digitorum that is entering the index finger. If you raise it, below you will see another muscle tendon, and if you trace it backward over here, you can see it belongs to this muscle. This is the extensor indicis muscle. Now we are left with one more muscle in the deep group, that is the supinator. For that we have to part the superficial muscles. Then you will be able to see a muscle at the very base or the floor. This muscle is the supinator. And if I part these structures over here, then you can see a nerve over here, this one. This is the posterior interosseous nerve. The posterior interosseous nerve, it pierces the fibers of supinator and then it enters the posterior compartment of the forearm. Now finally we enter the dorsum of hand. In the dorsum of hand, we don't find any intrinsic muscles. Instead, we find the extrinsic muscles, that is all the long tendons. Also, in addition to that, we see this is the superficial branch of the radial nerve which supplies the subcutaneous tissue, and we can also see the dorsal cutaneous branch of the ulnar nerve over here. The dorsal cutaneous branch of the ulnar nerve, as you can see, these are the different branches that supply the skin over the medial 1/3 of the dorsum of hand and the medial 1.5 fingers. Whereas the superficial branch, it supplies the skin over the lateral 2/3 of the dorsum and the skin of the lateral 3.5 fingers. Other than that, we should get the dorsal venous arch over here. But as you see, it is not present. Instead, what you can see, this is the cephalic vein, and this over here is the basilic vein. So this is the basilic vein. You can see it is running along the superficial fascial layer, along the medial border. Similarly, this is the cephalic vein that is running along the lateral side, and you can see they have formed a communication over here. Ideally, there should be a dorsal venous arch over here formed by the metacarpal veins, dorsal metacarpal veins, and the veins from the lateral side of index finger and the thumb. And the cephalic vein should arise from the lateral end of that arch, and the basilic vein should arise from the medial side. So that is all about the posterior compartment of the entire superior extremity. Thank you.